Healthcare reform. As an American, I feel that the problem that our nation is going through regarding healthcare today has been created from many insurance companies and physicians' great greed of money. Many Americans are currently without adequate insurance, or even no insurance at all, greatly due to the high costs of health insurance. I want to start by providing a brief history of how our country has been affected by the healthcare system and how the problems we are facing came about. It is amazing looking at the events that have led to the healthcare we have today. In 1901, the AMA, which is the American Medical Association, is organized with 8,000 members. By 1910, there were 70,000 members, half of the physicians in the country. This period is the beginning of organized medicine, and doctors are no longer expected to provide free services to all hospital patients. In the 1940s, President Roosevelt asked Congress for the Economic Bill of Rights, including the right to adequate medical care. President Truman offers a national health program plan proposing a single system that would include all American society. Truman's plan is denounced by the American Medical Association and is called a communist plot by the House Subcommittee. In the 1950s, the price of hospital care had doubled. Later, in the early 1960s, those outside the workplace, especially the elderly, had difficulty affording insurance. There were over 700 insurance companies selling health insurance, along with President Lyndon Johnson, that signed Medicare and Medicaid into law. In the 1970s, healthcare costs are escalating rapidly, partially due to the unexpectedly high Medicare expenditures, rapid inflation in the economy. American medicine is now seen as a crisis, and President Nixon's plan for national health insurance is rejected by liberals and labor unions. In the 1990s, healthcare costs rise at double the rate of inflation, and by the end of the decade, there are 44 million Americans, 16% of the nation, with no insurance at all. As we approach 2010, the price of health care has continued to soar, and more Americans are without health insurance. The mixed public-private health care system in the United States is the most expensive in the world. That fact that we are spending so much money on health care and education and continue to have serious problems in these areas is a valuable clue that something is wrong with how our current healthcare system is working. It tells us that we have overlooked areas of great importance. President Obama has stated that the problem with our healthcare system are one of the most important issues of his presidency. President Obama's administration has presented what is called the Affordable Health Care Choices Act of 2009. His administration has said that these would increase American choices in health care, also give Americans peace of mind, improving the quality of care for every American. According to this act, it will be offered to Americans as well as continuing to have the choice of other public insurance companies and plans. The bill will supposedly ensure that 97% of Americans will be covered by a health care plan that is both affordable and offers quality, standard benefits by 2019. Could Obama's plan be the solution to help end insurance companies and doctors' greed, or will it be perceived just as President Truman's plan was, seen as a communist or socialistic plot by the government? My personal opinion is not enough time and research has been completed by Obama's administration. I also have great concern with the cost in funding Obama's healthcare plan. I appreciate that our president has such great concern with our healthcare system and hope that his administration will continue to look for answers to the high costs of health insurance so that more Americans will have better coverage in the future.